welcome to On the Beat, everyone. I'm over here with Dr. Robert Phyfer from Brooks Eye Centre, and we're talking all about something that maybe we don't want to know about, and that is age-related macular degeneration. How are you, my friend?
I'm good. How are you?
I'm very well. Before we get to it, I want to say, what is macular degeneration to begin with? Because it seems like something that I will be looking for when I get a little bit older.
Age-related macular degeneration is a condition of the macula. The macula is just, it's a definition. We define a part of the eye, and it's your central vision. And what happens is you start to accumulate waste in this area of the retina, and it can't get rid of that waste. Well, that waste becomes toxic. That toxic waste actually causes vision loss over time. And we've got multiple different treatments to do that, different types of ways to prevent macular degeneration, but really what macular degeneration is a condition that can eventually cause you to lose your central vision over time.
Okay, how are you checking your macula when you go into the optometrist?
Well, we have a machine called a slit lamp, and we have a fundus camera. So our slit lamp, we're allowed to look inside the eye with a special lens. So we use a lens to focus it inside the eye. We also have a camera that allows us to see the macula as well. So we've got really two ways of identifying it. If we see anything suspicious, what we'll do is we'll go in and get a scan.
Yes.
So the scan is kind of like, best example would be like an MRI for the eye, and it shows us the layers of the macula, the retina, to see if you do indeed have macular degeneration and how bad is it. And that's how we grade macular degeneration: mild, moderate, severe.
Okay, now I'm probably going to ask a really silly question, all right, but I like to dumb things down. Do we need our macula?
Absolutely.
Okay.
Yeah. If you're looking at me right now,
Yes.
my face would be gone if you didn't have a macula.
Oh, really?
You would see everything else except my face.
Okay.
Your central vision and your color vision is from the macula.
So this is essential.
Oh, absolutely.
It's trying to lead a healthy lifestyle, because this is something that can be preventative.
There are preventative measures we can take,
Right.
but there's genetics that play a role in this.
So it's genetic as well.
It can be. And
Darn those genetics.
I always tell people that, you know, there's tips, and I tell people that don't even have signs of it. Being Caucasian is a risk factor. Caucasians are more likely to get it than African Americans. A smoker, poor health. You know, I've even started to tell people, you know, drink red wine at night. There's some studies come out that say red wine and resveratrol in red wine has been shown to help with macular degeneration or prevent it. So there's a lot of new stuff coming out, and we're still learning about this condition.
Wow. Okay, now, what are the treatments that can be done to maybe stop it, put it on pause, or fix it?
Good question. So there's two types of macular degeneration: dry macular degeneration and wet macular degeneration.
Okay.
We can't do anything about dry macular degeneration. We just have to basically watch it. The wet macular degeneration, we can actually do an injection in the eye, and what happens with wet is you have these leaky blood vessels that grow into the eye because it's just so toxic, and then these blood vessels just start to leak out. And so we use an injection to get the blood to go down, get the swelling to go down, and you can usually get some of your vision back. Now, preventative measures, we talked about risk factors. There are multivitamins you can take called the AREDS2 vitamins that have been shown to decrease the chance that you're going to get macular degeneration or the progression of it.
Okay, and look, you've got great information. Will you come back and talk to us more?
Absolutely.
I'd really appreciate it. If you want to find out more information about Brooks Eye Centre, or, you know, this amazing doctor, Dr. Robert Phyfer, about age-related macular degeneration, just go on, give them a call. They'll take care of you. Back after this short break.